Good. So my name is Lenore. I'm with the medical affairs team. So there's a whole bunch of us people who hang around and we talk to clinicians and we help to really support with creation of materials and things like that. So today we're just going to discuss kind of an introduction into nutrition. And so we'll definitely open up the last few minutes for some questions and answers, and I'll rely upon my medical affairs department people to help answer those questions. But let's just go ahead and get started here. So we see here this beautiful quote from Hippocrates says, "Let thy food be thy medicine, and thy medicine be thy food." When you think about the function of a medicine, it's really to restore optimal health. And food, to me, is really about a signal. It provides us with great information. And so rearranging this quote here, I like to say that basically food can help lead to optimal health. With all due respect, Mr. Hippocrates, I would like to add a few things in there. Because when I eat a food and it leads to, good health for me, does that necessarily mean that if somebody else eats that same food, that it will lead to health in them, or could it potentially lead to disease in somebody else? Furthermore, we have to consider, what about the quality of food? I'm not sure if you're aware, but if you take an apple nowadays and compare it to an apple from about 1950, it's a little bit different. We've actually changed our farming practices so that we don't do a lot of crop rotation nowadays, and because of that, our soil actually has less mineral and nutrients, which leads to fruits now versus 1950 being a little bit different in their nutrition status. So I respect Mr. Hippocrates, but I think we need to include in there not only food quality, but also individuality, because basically individuality is what makes me and you different from each other. So honestly, thank you for having me present today. I'm really kind of honored to be here. And what we're going to do is we're first going to start off with kind of some basic definitions to help get us on the same level playing field. And then we'll dig into a little bit more about different nutrients and how we change nutrients into energy. Hopefully I'll help demystify that magical process. And then we will review what's available at Genova Diagnostics in terms of our nutrition product suite line. And we'll conclude with some feedback that we received from not only clinicians, but also, some feedback that we received from patients as well. And then you guys can ask all the questions in the world if we have time left. Go. Change. Go. Okay. Can you change the screen? It's not working. Thank you. So let's begin first with the definition of nutrition. So this is Mr. Webster. So we can see nutrition is the act or the process of nourishing or being nourished. Specifically, the sum of the processes by which an animal or plant takes in and utilizes food substances. So let's break this definition down into two separate parts. First, let's begin with the act of nourishing. We can see that we nourish our bodies through four different pathways. Today, we will spend more time focusing on the digestion, absorption, metabolism piece. But we can also see transdermal, which is absorption of nutrients through your skin. We also have parenteral, which is delivery of nutrients directly to your blood or muscles through injections. And then lastly, we have enteral, which is basically a medical tube that directly delivers nutrients into your GI tract. The second half of the definition you can see here, it highlights food substances. Well, food substances, at the end of the day, is just nutrients. And you can see a nutrient is a substance that provides nourishment essential for growth and the maintenance of life. So in conclusion, I guess we can say that really to receive nutrient, it's really done through nutrients. So the function of nutrients, kind of broken down to three main things: to supply energy, promotes growth and repair body tissues, plus it helps to regulate body processes. And you can either take nutrients in from your food. In other words, your body necessarily doesn't make those nutrients, and that would be called essential. And then your body has the ability to make its own nutrients, and that would be termed non-essential. So with nutrients, we can actually break it down to two separate categories. We have macronutrients. Just looking at the title macro means that the body requires it in a large amount. We have carbohydrates, we have fats or lipids, and we also have proteins. And then we have micronutrients, where the body requires it in a smaller amount. Those are going to be your vitamins and your minerals. So the function of our micro and macronutrients are really to help promote growth and the health and development of a living organism. So basically, we're done with definitions now, right? Everybody's happy. You don't have to memorize any of them, I promise. I'll reiterate them as we continue throughout the presentation. But here we're going to help understand a little bit better. How do we take what we eat and use it in our bodies for energy? So first, let's dig into digestion. Digestion is literally just a process of breaking down the food you eat into really small particles so that your body can actually utilize them for something. So this whole digestion process really begins in the mouth, where we take a food and we chew it. So the act of chewing is called mechanical digestion, and while we chew our food, simultaneously it's being introduced to saliva, and saliva, our body begins to produce that just with the simple smell of food. And so with the saliva, it also contains enzymes that also help to break down the foods into smaller particles, and that's more of a chemical digestion process. Now, our tongue comes into play because our tongue, yes, it does distinguish sweet from sour and different tastes and things like that, but it also helps to make a ball-like substance for the food that we have put into our mouth so that we can propel it or push it down into the esophagus. Does anybody know kind of what do they recommend in terms of how many times should I chew food? Does anybody have a guess? 40? Yeah, okay, not 40, that's a slosh, yeah, but I would say around like 10, 15, exactly. But next time you eat something, actually calculate how many times do I chew before I swallow. It's very interesting because how can you really expect your body to really produce adequate enzymes and to produce the proper hormones to help with digestion if you're in a rush and you chew your food 3 times and you're swallowing big globs of food? Think about it. So then once one slide up, please. So we have next, once we're out of the mouth with food, now we have to take that ball-like structure that the tongue has made and push it into the esophagus. The esophagus is really like kind of a transport truck, right? So it transports the food through muscle contractions from the mouth into the actual stomach. So our stomach is an acidic environment, and the purpose of the acid is actually not only to help break down foods, but think about the water and the food you eat. You really think it's free of microbes and other nasty bacteria and things like that? Probably not. So the acid also helps to kill those things as well. You can see here that it basically breaks down the foods even further. Now, with stomach acid, this is very important for us to break down one of those macronutrients, the proteins specifically. And so imagine being able to either chew adequately because you have no teeth. Say you can't produce enough saliva because you have an autoimmune condition. Or what happens if your body just doesn't produce enough stomach acid? That can lead to maldigestion. Some common symptoms you might experience are actually belching and burping. You actually might see undigested pieces of food in your stool. It's kind of interesting. But why do we have low stomach acid, or why do we have maldigestion? You can see some potential medications and other things like that. So when you do nutrition testing, and if your patient has maldigestion, what you can actually see is an increased need for not only vitamins and minerals, but you can also see an increased need for amino acids, because once again, the acid is essential for helping us break down our proteins, giving us our amino acids. So let's complete the discussion with digestion, looking at these 3 different organs that help to secrete different products or enzymes that will break down the other 2 macronutrients we haven't discussed yet. So the pancreas, let's start there. The pancreas produces pancreatic enzymes. That's one of its many functions. And pancreatic enzymes is responsible for secreting 3 main enzymes that break down each of the 3 macronutrients, the carbs, the fats, and the proteins. And so what's really neat is that through our GIFX stool profile and our other stool profiles, you're actually able to assess pancreatic elastase 1. That gives us insight into your body's ability to produce adequate enzymes. And then we can see here with the next point that actually the pancreatic enzymes are secreted directly into the small intestines. Another function of those pancreatic enzymes is actually to help neutralize stomach acid that might have been introduced into the small intestines. So next we have the wonderful liver. And so the liver helps to actually make bile and also to secrete bile. Now bile basically emulsifies, or it breaks down your fats that you take in through your diet. And that's important because the fat that we take into our diet is very essential to help provide energy and other important things for the different organs in our body that we'll elaborate in just a second. But the bile also helps to neutralize the acid that might enter into the small intestines, and also it's secreted into our bodies really to help break that fat specifically down. The gallbladder is basically a storehouse for our bile. It helps to also concentrate the bile, and also the, products of that can be released into your small intestines. And inadequate bile, basically, which can be a cause of alcohol. You can have inadequate bile because you smoke. You can have inadequate bile potentially because you're taking a medication that will impair bile secretion. And in those cases, we might actually have difficulty, or we might see on nutrition testing an increase in nutrients that require fat to be broken down. So now let's transition to absorption. So we're still within the small intestines, and yes, the small intestines has two functions, not only to complete digestion, but also help with absorption. But absorption is really the process that occurs after digestion. And basically all we're really doing is transporting or moving across the intestinal mucosa these nutrients so that they can enter into the blood and be distributed to other important organs of the body. So with the small intestines, this is kind of where that whole absorption process really initiates or begins, once we have those really small particles. And when you have issues with absorption, common symptoms that you might experience can also be kind of more of your global GI upset symptoms. But when you look at testing somebody who has malabsorption, we can once again on nutrition testing see insufficient nutrients and or minerals. And you can see here, it explains why would somebody have inadequate absorption. A lot of times it's because of surgery, like say somebody, for example, had a gastric bypass where they divert food from their stomach a little further down in their small intestine tract or even into their large intestines to help with weight loss. That definitely can be a way that we have malabsorption. Chronic diarrhea, and then damage potentially to the small intestines, whether you have a chronic inflammatory bowel disease. Those are different things that can lead to malabsorption. So then the elimination process, that really occurs in the large intestines where we take what's left and we mix it with water, and then we excrete it through feces. And so the large intestines, in terms of our ability to eliminate, can really be impacted if we don't drink enough liquids. What happens if somebody had a surgery, or if we're physically inactive, right? Because when you're physically active, it builds muscles, but keep in mind your intestines also have muscles in them too, and so they also do contract and relax and have these different ways that pass food through. So if we are potentially doing something to impact bowel elimination, we might have constipation. And one of the results of constipation can actually be hemorrhoids. Not the best thing in the world. So the large intestine also has a lot of other key functions in terms of it helps to house our gut bacteria or our microbiome. And so those are the really helpful anaerobes that, we look at in stool profile testing that we can also evaluate that way. But it also is a place where our body produces our short-chain fatty acids through basically fermenting non-digestible carbohydrates or fiber. And the short-chain fatty acids are really important because they help to maintain overall colonic health. They also help with absorption and a variety of other functions. So this is metabolism, right? This picture is beautiful in my opinion because you take the food through your mouth, you digest it, and then the body somehow is able to take that food particles or those nutrients and convert it into energy, where then we're able to rebuild tissues, we're able to dance, have fun, do whatever, as well as it eventually will lead to excretion. So let's talk about this process, taking foods and moving it into energy. So back to the beginning where we started with all those definitions of the two types of nutrients, macronutrients versus micronutrients. Let's now talk about what macronutrients really are. Once again, they're required in a large amount in the body, but you can see it helps to support the growth and health development of a living organism. So the three macronutrients are going to be your carbs, your fats or your lipids, as well as your proteins. So let's start off with the carbohydrates. So why do we need them? So carbohydrates are actually very important because they help to provide a fuel or energy source for either daily activities or future activities. And look at these different foods that we find carbs in: whole grains, fruits, veggies, and legumes. What you'll notice is that majority of those foods contain fiber. And fiber really helps with those short-chain fatty acids and protecting colonic health that lives in the large intestine. And so that's what we're referring to here in this last point there. The next one is how do we assess carbs? So there's no direct way at Genova that we actually assess carbohydrate intake. However, there are byproducts of the NutriEval or ion profile that we can look at, such as beta-hydroxybutyric acid, pyruvic acid, and lactic acid. That gives us a little insight into basically what's going on with carbohydrates. So then we have lipids. Lipids provide us with energy, and it also assists with absorption of fat-soluble vitamins that we'll discuss in just a bit. But what's really interesting is that lipids are actually needed to help maintain good cardiovascular health, good brain health, as well as supporting our immune system. So we assess lipids using the fatty acid profile, either on the NutriEval or ion or standalone profile. In terms of what types of fats do we have, a lot of people really focus in on the polyunsaturated fats, which are omega-3, 6, and 9, and the goal really is balance. That's kind of how I look at it, where you want to be a little bit more dominant in omega-3s, which is coming from fish, flax, seagrasses like seaweed, and even walnuts. You also have, you also have saturated fats and trans fats, and so we want them a little lower in our diet due to their increase in cardiovascular risk as well as other chronic diseases. So proteins, as we talked about earlier, are broken down in the stomach through acid, and then they're delivered into the small intestines, but they're basically building blocks. They help us to make new proteins. They also help us with making hormones and enzymes, a good energy source, as well as supporting our immune system. And so how we assess these proteins to the NutriEval and the ion profile, looking at the amino acids. So I really like this diagram because I think that it kind of summarizes everything we've talked about so far. So we start off with food, and then we digest it and all that kind of fun stuff, and then there are macronutrients, the proteins, the carbohydrates, and the triglycerides or the fats. And you can follow down the left-hand side. You see that the proteins will give us amino acids, which are important for protein synthesis and making hormones and energy. In the very center, we have the carbohydrates, where we can see this is where we get our energy source from, made from glucose. Off to the right-hand side, we have the fats that we can see is important not only for structural membrane purposes, but also for maintaining good brain and cardiovascular health. So we're mainly going to now discuss and transition into the citric acid cycle, where we're going to combine micronutrients into and macronutrients and how we utilize them. But this citric acid cycle is mainly focused here around that glucose to energy production. That energy production area is where the citric acid cycle really comes into play. So the citric acid cycle, the first thing to note is where does this really occur? And it occurs within the mitochondria, which is really like the powerhouse of the cell. And so this whole process is basically a sequence of reactions with the main goal of producing ATP or energy. And so you can see the macronutrients, the fats, the carbs, the proteins, basically flow into the citric acid cycle. So those are definitely required. So now let's talk about micronutrients and their role in helping us to make energy with this same cycle. So micronutrients, the vitamins and the minerals, basically function as what's called a cofactor. So when you're trying to convert A into B, you need to use of an enzyme. And the enzyme requires cofactors like the vitamins and minerals to allow it to work efficiently. And let's just take this as an example. We see here pyruvic acid as it converts into acetyl-CoA. Click. We can see the cofactors, the magnesium, lipoate or alpha-lipoic acid, B1, B2, B3. Click again. But we also have to keep in mind that, you know, this whole energy production cycle, it looks all fine, well, and dandy, but there are a lot of things that can actually inhibit the process, such as A as arsenic, Hg mercury, and Sb antimony. So we need to be very mindful of not only the nutrients that we have, but also things that might interfere with that process. So hopefully you're able to see now that, you know, the whole idea of nutrition and food, it's just not that simple with the end result of energy or making proteins or making hormones or enzymes. So now let's dig a little bit more into the micronutrients, those vitamins and minerals. So absorption is basically where we take those micronutrients and bring them into the blood so that we can deliver them to various essential organs. And basically the combination of micro and macronutrients is what helps to sustain life. So the micronutrients can be divided into two categories. The first category is water soluble. So that encompasses our B vitamins as well as vitamin C. The second category is fat soluble, which encompasses vitamin A, D, E, K. So I really want to highlight here on the left-hand side of this chart that the B vitamins also have not only an associated number, but it also has an associated name. So this is extremely confusing to clinicians as well as patients. So you can see B9, vitamin B9, can be called folic acid. And sometimes that gets confusing to clinicians when you say B9 or just folic acid. Sometimes they don't make the link. So you can see food sources and what happens if you're deficient in any of those nutrients. Now, I'm not going to go over everything for today. We're short on time, and I'm sure you guys know how to read. So hopefully when you have access to this PowerPoint, you'll be able to look at it so you can see basically how do I get robust amounts of these vitamins and what can be a side effect if I don't eat, for example, my green leafy vegetables. I can have some symptoms like this. So the other water-soluble nutrient is vitamin C, and vitamin C, a lot of times we think about our fruits and things like that, the citrus fruits and foods. Vitamin C is very important for not only helping to maintain adequate or healthy immune function, but also it plays a role in terms of bone health as well. So next we have our fat-soluble vitamins. And as the name implies, fat-soluble. So for us to actually absorb these vitamins, A, D, E, K, it requires healthy fat digestion and absorption. So remember we talked earlier about bile, and we talked about the pancreatic enzymes. If any of those are basically thrown off or not working efficiently, we can potentially have insufficient levels of these fat-soluble nutrients. So how do you really become deficient in vitamins? You know, it kind of sounds like a funny idea because it's like here in America, we really don't have, well, I don't want to say that, but majority of us really don't have issues with access to food, right? So how can we become deficient in nutrients then? Look at this list: alcoholism, drugs, medications, poor diet, taking hormones, maldigestion, malabsorption, having an eating disorder like anorexia, or being bulimic, for example. So these are basically indicators that if you know that somebody or yourself is engaging in any of these, then we might need to consider evaluating what does our nutrient status really look like. So now let's discuss a little bit more about minerals, which is one of the which is also a micronutrient. So minerals, the role in the body is to function as a cofactor, helps maintain pH balance in the body, and also it helps to regulate the growth of tissues. Now, where we get minerals is in food and in water. And the two types of minerals, we have macro minerals and micro minerals that will be highlighted on the next page. And you can see the nutrient element assessment via the ION or via the Nutri-Eval. You can also have a nice assessment of them. So you can see examples of both macro and micro minerals that your body requires. For macro minerals, you can see important for bone, muscle, heart, and brain function. And then for micronutrients, they're generally used as cofactors. So let's go ahead and discuss what the nutrition product suite is that we have available at Genova Diagnostics. So we have the Nutri-Eval or ONE profile. And it encompasses the metabolic analysis markers or organic acids. It encompasses amino acids, which can be measured in blood or urine, the essential and metabolic fatty acids, and then oxidative stress, elemental markers, as well as vitamin D add-on. The ION Organics profile, very similar to the Nutri-Eval, also looks at the amino acids, plus this one looks at homocysteine in addition. Fat-soluble vitamins like vitamin D and vitamin A and CoQ10 that we discussed, as well as oxidative stress markers in both blood and urine, nutrient and toxic elements, fatty acids, and then organic comprehensive profile or the organic acids as well. So when do we want to really assess nutrition status? So we talked about other things earlier, you know, being an alcoholic, having maldigestion, malabsorption. These are some indicators. But these are some symptoms or some chronic conditions that we might want to decide to assess nutrition. So the most common one I actually find that clinicians order this nutrition profile for is actually because people are presenting with mood disorders. That's probably the most common one. And then also we hear a lot about people ordering this profile for those with chronic diseases like diabetes, for example, or cardiovascular disease. And then fatigue is another big one. So with the nutrition product line, you have the Nutri-Eval. That's kind of the big mama. And then it can be divided into the ONE or optimal nutritional evaluation profile, which is strictly urine. So it does not have any blood markers such as your fatty acids. And then we have the metabolic analysis page, which is strictly urine, just like the optimal nutritional evaluation, except that this one does not include amino acids. And then the ION profile, another big daddy kind of profile that's very comprehensive. The smaller version is organic, which is just a urine portion that just looks at the organic acids, like the citric acid cycle and all those kind of markers. We also have an integrated profile called the Triad, and the Triad profile looks at the allergic or antibody profile. So here we're looking for the presence of or the production of immunoglobulin G, which can signify that the patient has some kind of a food sensitivity. And then we can also look at amino acids in plasma, as well as organic acids, telling us about the need for basic micronutrients. Oxidative stress profiles evaluates basically how well are we balancing free radicals, which can either be introduced to us through our environment, whether that's inhalation of smoking, radiation exposure, or even inside of our bodies, we actually do produce free radicals, which is a normal process, right? When we breathe in and do cellular respiration, you're kind of making free radicals, okay? So we're looking at how the balance of the production or the exposure of free radicals is compared to our antioxidants, which will combat those free radicals. And then we have health risk assessment. So we have, still within the nutrition product suite, ways to assess cardiovascular health. What's really neat is the CardioION not only assesses cardiovascular risk markers, but also provides you with the nutrition aspect of how that will impact cardiovascular and heart health. And then the CV Health plus Genomics to the left of that gives us some genetic markers that talks about one's predisposition to cardiovascular disease. And then the CV Health just looks at some various blood markers that tells us about what's going on with, like, cholesterol, for example, that might be a little bit more familiar. Then we also have a bone resorption assessment, and it basically informs us how fast are we breaking down our bones. So this becomes really important for especially our women who are entering into that menopause range, where we tend to have more bone breaking down than we have bones that are rebuilding. Lastly, we have the element profiles, which evaluate toxic exposure to various elements that can not only interfere with the citric acid cycle and make energy, but it can also act as hormone mimickers, and so it can interfere with hormone production and excretion. It can give us crazy symptoms like numbness and tingling. It can give us symptoms like I don't feel like eating, more anorexia. So let's go ahead and just kind of review a few positive feedbacks that we've received from both patients and clinicians. So this first case is a 19-year-old female. I had the pleasure of speaking with a clinician on the phone not too long ago, and she's basically a 19-year-old. She's a long-distance runner, so entering into college, you know, more of a competitive environment, I should say. And basically, she hit a plateau in her performance. She's not getting better and she's not getting worse. And so they wanted to run this profile to kind of evaluate what's going on. Could it be due to nutrition issues? And so for this result, we did see low overall amino acids. Well, what were amino acids needed for? To help us rebuild muscle tissues and things that might have been broken down. Well, guess what you do when you exercise? The amino acids will also help function or feed into the citric acid cycle to give us energy. And then she also had low B vitamins. Well, that's really important for the citric acid cycle to work efficiently, as well as give us energy. And then her antioxidant status was low as well. So the clinician went ahead and implemented the protocol that we recommended, plus made some tweaks and adjustments to the patient's diet, because as you know, if you're an athlete, your nutritional requirement is going to be different than mine, because I sit on the couch. I don't do much, okay? And then also we see that she not only had improved stamina, but she actually was able to train more effectively utilizing weights, and the clinician reported that the patient was very happy. The second case was a 31-year-old female who had a 4-month baby, and unfortunately she had postpartum depression. The baby was breastfeeding until about 2 months, and currently the baby's being bottle fed and thriving well. So the patient reported experiencing extreme fatigue. They noticed some mood change in terms of being a little bit more irritable and depressed. They're on a standard American diet, which means takeout, fast food, pre-prepared, pre-packaged foods, because she literally had no motivation to cook. So we can see the Nutri-Eval results there, and basically was following up with the nutrition dietary support. The clinician reported that the patient's mood has not only improved, but she's starting to see significant changes in energy. Additional feedback we've had from clinicians is, can't believe all the information I got from the Nutri-Eval. It's amazing once you grasp it. The addition of the genomic markers to the Nutri-Eval profile has been invaluable, aiding in my clinical decision for my patients. The recommendations on the Nutri-Eval in terms of the food sources and the nutrients has been an important teaching and learning tool for my patients. So basically they're referring to, on the Nutri-Eval, we have the interpretation at a glance page that tells you why could somebody be deficient in a nutrient, and what foods could you eat to replenish those nutrients. And then on the Cardio-Ion clinician reports, it was a more comprehensive understanding of how my patient's cardiovascular health can be impacted by nutrient insufficiencies. And lastly, I love the combo of the triad for GI patients, especially when added to the GI effects tool profile. Now this is where I'll ask my wonderful colleagues to chime on in here, just in case you guys have any questions. Go for it.
Are you going to send this PowerPoint out to everybody?
I believe it might become available on Core, is what my understanding is.
Okay, cool.
Hey, Lenore, can you guys hear me?
Yes, we can hear you. Wow. Hi.
Hi. So the recording, the presentation, as well as the audio will be posted to Core, and that link will be sent out to everyone.
Thank you.
There are a couple questions that were submitted online. The first one is, can there be absorption issues even if the patient is getting IV therapy or IM injections?
So typically, when we think about IV or IM injections, it is being delivered directly into the blood or into the muscle, so you wouldn't necessarily expect there to be absorption issues. However, it also depends on what type of the nutrient you are giving the patient, what form of the nutrient is that IV or IM injection in, because some patients might actually have difficulties converting a nutrient that you give to them into the active form that their body is actually able to utilize. So you would expect it, I guess, in essence, to be directly delivered to the body and the blood, or to the blood and the muscle tissue, but there might be some interesting, not as common cases where it might also show up as malabsorption on our nutrition testing.
And then could you talk a little bit about the water-soluble versus fat-soluble vitamins and the time frame that may be reflected on our nutrition test?
Absolutely. So with water-soluble vitamins, they are basically pretty much cleared from the body in a really short period of time. I would say probably 3-4 days, whereas fat-soluble nutrients, because it's fat-soluble in our fat cells, it does persist longer in our body. And so that's a great point when you're considering looking at the NutriEval profile and you see that the patient is deficient in fat-soluble nutrients. That's telling you that, hey, this is not just a short-term issue, versus if they're just deficient in water-soluble nutrients, maybe something happened the prior 4 days, right? Maybe they just ate a totally diet and it's washed out from the body.
I have something that's interesting with that. I just actually spoke with a clinician yesterday, actually a couple of days ago, and that very question came up about B vitamins. And I did some research, and there was a study that came out that said that vitamin B12, the half-life for it in the body is like 20 to 50 minutes. And so it doesn't take long for us to utilize water-soluble vitamins, especially if you're under situations of stress or there's any kind of oxidative body, mental, emotional stress, anything that can deplete it, caffeine, alcohol. So the need for those water-soluble vitamins are something that you have to readily replenish on a daily basis.
And even also if the patient has an issue with making the conversion from the active to the non-active form, that can be something else that'll lead to those water-soluble nutrients kind of depleting quicker.
We also got a question wondering if the ION test uses an algorithm like the NutriEval does to determine nutrient need.
Yes. So basically with the ION and NutriEval profile, there is an algorithm established for what we call pediatric populations, or those from the age 2 to 12, and also there's a recommendation for those who are 12 and older, more of adults, and that is taken into account with the algorithm. All the information is entered into a really complex computer program, and it provides us the need for various nutrients. Now, for example, for for some of our B vitamins, we look at over 20 individual markers to provide us insight into the need for a B vitamin. So we're not just looking at one little thing to say, yes, you need B vitamins. Like, we're not jumping to crazy conclusions. We're actually combining all that information to arrive at those recommendations.
Another question was, can getting too much of a nutrient be bad also, or is excess are excess nutrients simply eliminated?
So, great question. So the answer is yes, yes, no, no. Because you can, like, for example, your water-soluble nutrients, like if you've taken a whole bunch of them, yeah, you'll probably just excrete them in higher amounts. But what happens if you have, let's say, high amounts of vitamin D, or let's say you have high amounts of minerals, you know. In those cases, you actually can start to show symptoms of toxicity. So it really depends on the nutrient, it depends on if it's water or fat soluble, and it depends on if it's considered, can potentially be a toxic element or not, okay? So there's a lot of factors to keep in mind. For example, magnesium. If you take too much of it, even vitamin C, you'll probably be living on a little toilet because it will move you pretty rapidly, okay? Oh, you won't make it to the toilet. Okay, good point, Dr. Davis. Good point.
You want to hear an interesting story?
Go for it.
So this happened a few years back. They were finding all these people coming down with neurotoxicity, and they couldn't figure out anything. It was continuum of all these patients, except that they all had dentures. This was a homely similarity. And they all had dentures that didn't fit well. And it took them a couple of years to figure this out. But all the denture paste and all, they had high levels of zinc. These people would use it 4 or 5 times more than they were supposed to get their dentures to fit. Well, in the meantime, using all that zinc, they were stripping copper out of their body. And so they had a deficiency of copper, which was causing neurotoxicity.
Wow.
Very interesting. And then with poor fitting dentures, how do you expect to chew your food well?
Yeah. That would have come later.
Yeah.
Those are all the questions that we've gotten online.
What about y'all?
I have a question.
Oh, sorry.
You said earlier that there are people who don't produce enough saliva.
Yeah.
What happens when you can't? I mean, figure to the digestion.
Yeah, so remember, saliva also contains enzymes, right? So that helps to further break down your food. So potentially if you don't secrete enough saliva, you're not breaking down your foods very well, and you can see maldigested pieces of food particles in your stool sample, right? But something else happens very interesting when you don't produce enough saliva, because remember it has the enzymes in it, right? So that actually also helps to maintain good dental teeth health. And so sometimes when you don't have good saliva, your teeth aren't in the best shape, and they might just fall out on you. You might get extra cavities or gingivitis, so, it's a very valid question, because, what does happen? Like, who doesn't produce enough saliva? But there actually are autoimmune conditions that can decrease your body's ability, and some medications, in fact, can decrease your saliva production. So, a little bit more common than you think. Anything else?
We had another question. Do we offer a profile or panel that looks at fatty acids, bile acids, and fecal fats as a means to look at the whole picture?
Good question. So, so we don't look at we don't have a profile that looks both at all of that in combination. But the GI-FX stool profile, I think, is a phenomenal option, because it looks at our ability to break down the food through those pancreatic enzymes. And with the fats, if we have either too high amounts of fat being delivered to the stool sample, then that might suggest we have insufficient fat-soluble nutrients, or it might suggest that we have insufficient bile production. But, at the end of the day, increased fat in your stool sample can be due to a lot of things outside of insufficient bile. I just kind of painted a very simplistic picture. You could also have fat being screened into the stool sample if you have celiac, for example, where you can't eat gluten because it interferes with absorption, so you'll get a lot of fat delivered to your stool sample. And then in terms of the GI-FX stool profile, it also evaluates part of the protein breakdown that can provide us a little insight into how your body is doing at producing acid. But we don't have a panel that looks at that digestive piece, plus looking at your actual fatty acid amount in your profile. Now, the NutriEval profile can provide insight into potential maldigestion, malabsorption, but it doesn't give you kind of the same information that the GI-FX stool profile would be. So, in my opinion, do both.
We had another question. Oh.
Number.
If a doctor is concerned with a patient's nutrition, how often do we recommend the NutriEval?
Ooh, I like that question. Okay, so we recommend the NutriEval or nutrition testing about every 6 to 12 months. However, I think it really depends on what does the patient really have going on and how compliant are they with your protocol, because I think that will potentially change when you decide to retest within that 6 to 12 month spectrum. But for example, I actually had a case today where I recommended that a clinician might decide to test a little sooner than 6 months because it was a patient who was looking at becoming pregnant. And think about this. Yeah, I'm pregnant. So think about this. When you're pregnant, you kind of need a whole bunch of amino acids on board to kind of build a baby. It's a little bit important, right? You also need fatty acids to help with neuron or brain development for the baby. And when I looked at the profile of this young lady, I was like, wait a second. What is she eating? Does she eat? You know, so for her, because, you know, she was a little bit advanced in her baby child rearing ages, you know, I recommended maybe you want to consider really going in hard, implementing these strategies to improve her digestion, absorption, her nutrient status, and retest sooner, because the goal is to get pregnant right pretty soon. So there are cases, in other words, where we would recommend something a little bit sooner than 6 to 12 months that we traditionally talk about. Go for it.
Okay, so you said that there are certain medications that probably prevent absorption, right?
Yes.
Okay, so when the doctors request the test, and they're getting back the results that probably shows malabsorption when they contact you, usually. Is that one of the questions that you ask them?
Absolutely, absolutely, because it's actually really common. I mean, even if you consider birth control, right? A lot of people are on birth control. Okay, a lot of women are on birth control, right? So birth control actually has the ability to interfere and kind of deplete our B vitamins, magnesium, fatty acids, zinc, right? And I can just go on and on with the list. So it interferes with not only our vitamins, but also our minerals and other substances. So that definitely is a question that I pose to clinicians, because it could potentially explain why there is a need for various nutrients outside of, I'm just not eating them. So that's a great question. Great question. And then even your acid blocking medications, that's very familiar, that people can either buy in stores or be prescribed by a clinician or a doctor. If it blocks your acid, remember what we talked about earlier, acid is important for breaking down our proteins and giving us amino acids. So this blocking acid can actually interfere with our total amino acid status, which on the stool profile, you might actually see elevated products of protein breakdown. Because if you don't have adequate acids, then you're going to find more products of protein in the stool sample. So it is definitely a question we not only ask with the Nutri-Eval, but also with the stool profile as well. If you ask a question, you can answer it.
All right. So the point you made in the presentation about our soils being more depleted now of the minerals necessary to really fortify our foods with those nutrients necessary, you know, for health. What would you say the importance of getting those nutrients from supplements? What role do supplements play in that, due to foods not having as many nutrients available?
Great question. Great question. Do you want to talk, or do you want me to? All right. So I think that's a great question. And unfortunately, the answer is a little bit kind of complex, because who wants to be taking vitamins and minerals for the rest of their lives? You know, let's just be realistic with it. So this is where I feel that taking a variety, or consuming a variety of food sources that might have different minerals and nutrients in them really becomes important, okay? So, okay, we know that, vitamin B9, folic acid, is found in dark green leafy vegetables. So I'm not saying just eat kale for vitamin B9. No, you can also get exposure to B9 through beans. So eat a variety of foods that can give you exposure or provide your body with several different nutrients and, you know, micro and macronutrients. That's kind of the way I approach it. But now, are there certain periods of life where you may need nutrients, like supplements? Absolutely. Me, for example, right? You know, being pregnant increases your nutrient needs. Even after you deliver a baby, you still have increased nutrient needs, especially if you're breastfeeding. If you're on a slew of medications that could deplete your nutrients. There might be an indication that you need some extra nutrients, you know. So there are cases, and that's why we talk about the individuality, what makes you different than me, where we might need to consider supplements more long-term or during certain parts of one's lifespan. Go for it.
How common is it to find problems with malabsorption or deficiencies in people who don't have overt symptoms?
That's a great question. So let's also add in people who don't take medications. Okay? It actually is not extremely uncommon, to be honest with you. So that's why nutrition testing really comes into play, because when you say overt symptoms, a lot of times people just think of GI symptoms, right? But what happens if I have fatigue? That's a symptom, you know? But you might not directly associate that with nutrient insufficiencies, you know? So, or maldigestion, malabsorption. So I think it actually is a little bit more common than we probably think. Yeah. No, that's a great question, though. That's a great question. Especially if you have medications on board. Yeah, good luck.
We had a question wondering if we test for macronutrient levels. As an example, do we test for potassium and sodium levels in blood?
So, in our, you can scroll back a few pages. So, keep going, keep going, keep going, keep going. Yep, keep going. 5, 6 more slides and stuff. Keep going, pass all that. Keep going, keep going. Keep going. There we go. Here's the answer to your question. So we do look at these elemental, these nutrient elements, some of these minerals, but keep in mind that this is actually an add-on to the NutriEval profile, and on the ION profile, we also do evaluate them as well. And we also look at quite a few of them on our elemental profile, specifically the comprehensive urine element profile, where we look at toxic elements that can interfere with your body, but also we look at a pretty comprehensive list of other minerals and things like that. Great question.
Just to clarify this, we look for the potassium and magnesium in the red blood cells.
Correct.
Start getting into the serum, where you're measuring the sodium and the potassium and the magnesium. That has nothing to do with nutrition. It's about electrolytes.
Exactly. Exactly. Yep.
We've got another question from what I call TV land. If a patient is getting a lot of B vitamins through supplements, IV injections, that kind of thing, but the NutriEval shows that they still have a high need, what are a couple of things that we would think about that might be causing the deficiency, and or what are things that may, we would speak to a clinician about to explain why the NutriEval would still show a higher need for those things?
Great question. And so if, I recognize it's time, so if you guys have to, leave, it's totally okay. So that's a great question, though, because if somebody is orally taking B vitamins and there still is a need on the NutriEval profile, then we do consider malabsorption and maldigestion, as well as there can be genetic SNPs that can actually interfere with how we take the B vitamin we're supplementing with and making it into a more active B vitamin. And then the other thing to consider is, well, what happens if the patient's last B vitamin dose, because we do recommend for those profiles, especially NutriEval, to discontinue supplements 4 days prior to the test. What happens if they haven't had any, water-soluble B vitamins during those 4 days? Well, as Madi was alluding to earlier, they have a short half-life. They're going to be, we're going to see need in the NutriEval profile. Now, if somebody is receiving an IM or an IV, it depends on the timing, when the last time they received that treatment. That would help me decide if maybe they received that treatment, say, 2 months ago and it's depleted in their body. Well, yeah, that kind of makes sense, And then I think there was a third part to that question.
Would there be, are there other tests that we may recommend for those people to help also assess different need for B vitamins, difficulty with absorption, that kind of stuff?
Yeah, so I would also, for those people, you can recommend doing a genetic test, looking for like MTHFR, COMT, that helps us to move the vitamin that we take in from our diet or that we might get from a supplement and make it into a more active form. But then we also might want to consider like the GI effects full profile, because potentially that'll illuminate or highlight maldigestion or malabsorption issues if we see that kind of result on the NutriEval profile despite everything else they're doing. Okay. Thank you. I hope you guys